within the next 5 to 7 to 10 days, I think we're going to see failure of the hospital system in Mississippi.
Doesn't mean the hospitals close, but it means if you call 911 and you can get yourself an ambulance, the ambulance will turn you away at the hospital.
I don't want to say that we have reached the point of failure, but we are definitely headed that way.
The waiting rooms are full of all kinds of things, not just COVID, some, car accidents.
There were a bus wreck of kids. We would not be able to take care of all those kids at this hospital.
We're human. We can't live forever. We are going to catch all kinds of diseases and illnesses and other viruses, and we get hurt sometimes.
Heart attacks and the strokes and all these other things that we need to take care of that have time-sensitive care issues, we're not going to be able to take care of.
With Mississippi hospitals near calamity, Governor Reeves leaves state for Republican political event.
We have 21 pediatric patients in the hospital today, 6 in the ICU, 4 on ventilators. Definitely the highest number that we've had through the entire pandemic. Boarding pediatric patients in our pediatric ER, I think about 10. So all of our hospitals are full.
And because all of the Mississippi hospitals are full, the state's largest medical center is now attempting something shocking and dramatic. Hello, everybody. I'm David Shuster, and thanks for joining us. In order to create a little extra capacity, the University of Mississippi Medical Center is now building a field hospital in the parking garage. That's right, the parking garage. Officials hope to utilize the parking structure to treat older teenagers with COVID. The theory is that this field hospital, staffed in part by federal disaster teams, may free up a little extra space inside the main facility for the record number of younger children who keep arriving with COVID. And by the way, it's not just Mississippi that is reaching full capacity. Several states in the U.S. South are heading in the same direction, and the COVID numbers keep rising. And never mind the treatment of children. In Mississippi, doctors and staff will soon have to make some tough choices about the care for grown-ups. Will the limited resources go to the heart attack victim or the person having a stroke? What about the elderly person who fell and broke their hip? At a certain point, doctors will have to decide who has the best chance of living and who must be allowed to die, and die from something that is often, under normal circumstances, not fatal. That is the frightening situation that is coming. And even in the U.S. South, it did not have to be this way. Vaccines work. The shot may not keep you from getting COVID, but it prevents the serious COVID impact that will kill you. Social distancing stops the spread. Proper masks stop the spread. The science is clear. And yet, countless red state leaders are still in lockstep with the right-wing lunatics. And now, hospital systems, starting in Mississippi, are going to collapse, and a lot of people are going to die, not just from COVID, but from things that are usually treatable. Well, when you see your governor downplaying the COVID numbers or saying he's going to cut the funds of any school that requires masks, remember, that's not just conservative, it's extreme. And the extremists who support this insanity, they should be the first, when in need of medical help, to get it in a parking garage or have treatment denied altogether.